Hello.
Hi.
How are
How are
you?
you? I'm well, thank you. How are you?
I'm very well, thank you as well.
Good.
Thank you for taking on such short notice the podcast. It's a delight, actually.
Well, if as my mother used to say, if you don't ask, you don't get. So here I am.
Absolutely, absolutely. So, how you been? I hope you haven't interrupted you in any work as such.
No, because if I was working, I wouldn't have agreed to have done this.
That's right. That's right. For anybody who doesn't know Windy Dryden, a wonderful leading practitioner. He's a senior in the field of CBT, rational, emotive, cognitive behavioral therapy, which he leads. And he's a professor at Goldsmiths University and has published over 200 books, which is fascinating, all over the world, which have been distributed. And yes, it's lovely to have you here. I mean, it's a pleasure talking to you.
That's fine. Just a slight correction. I'm actually what's called emeritus professor at Goldsmiths University of London, because I retired from active service, as they say, in 2014, and so I remain associated with it through the title of emeritus, which is Greek for old man, apparently. No, it's.
I love you've got some humor as well, which is always good to have.
Yep.
It didn't actually say that as married, because when I went on some of the websites, it did explain that you're still active there. It might have been just a.
Well, they haven't been paying me, so.
You might want to check that.
I'll check that. Yeah. Mm.
So tell me about yourself. I mean, I've watched a few of your podcasts, and I was intrigued in general about not just that you are such an established practitioner in your field, and you have published all these books and so on. You're quite expert in these things, but you have a very humble beginning as well. And in general, the way you talk was really intriguing about humanity, about how you want to help.
Well, I was born in Hackney in East London in 1950, and my parents and we lived in a house where in the basement was my uncle and his partner. In the middle was my aunt and her daughter, and at the top was myself and my parents. So it was strictly a family house, and it's still there actually. And I still go back sometimes, with affection to Hackney to see the old house. But so yeah, I grew up there, went to school. I actually went to school in a school called Avigdor, which is quite a religiously oriented Jewish school, and I think I was taken away from there because it was felt by my parents I was getting too much of a religious education and not enough of a non-religious education. So I went to a primary school in Hackney, and then passed my 11 plus and went to a boys' school called Central Foundation Boys' School, which is still there, apparently, in Old Street, and then became quite, I was sort of more oriented to languages than anything else. And so my A-levels were French, Russian, and Latin, which is a bit of a shame because I can't speak any of them. Well, I can't speak Latin, but because the education in those days wasn't really oriented towards speaking the language. I can translate, the fables of La Fontaine, but I can't have a conversation with a Parisian, which is a bit sad. Anyway, so I realized, because I had a bad stammer, that I wasn't going to really, make any kind of living from languages, maybe translation, but that wasn't my thing, certainly not interpreting or anything like that. So my father wanted me to become a lawyer. He said, son, become a lawyer. There's only two types of lawyers, rich ones and millionaires. I said, well, that very well may be the case, son, father, but I'm not interested in the law. So he said, well, who cares if you're interested in it? Because he was brought up, he was quite a talented man. He was brought up by in his household. He had to leave school early in order to help, right, bring money into the family. So I think he was kind of very much thinking about the importance of earning a good living. And for him, even though he was a talented drawer, he became a ladies' tailor, and then latterly he became a taxi driver. And I think he kind of did not fulfill his potential as a person.
Right.
But so what was kind of more important to him, not was me fulfilling my potential as a person, but earning a decent living. So not for the first time, I ignored him and went off and did psychology, and the rest, as they say, is history.
Well, it all links to each other. Geography, history, psychology, which is quite nice to see, because everything has some form of merging history within each other. Quite interesting to see how you emerged from Hackney as such, from a humble beginning, and then went into psychology. What was actually the reason? What did drive you to psychology in general? I mean, I'm a linguist, so I can relate to the languages itself. I do speak them as well. But in terms of psychology itself, I mean, it's very different to your upbringing.
Yes, although, I mean, I one of the books I did with a number of years ago was with a colleague of mine called Laurie Sperling, and we did an edited book on, I think it was called On Becoming a Psychotherapist, and we asked noted psychotherapists to talk about how they became a psychotherapist, what were the factors that influenced them. And although we didn't actually contribute chapters ourselves on that theme, as it turns out, the reason was quite a common one, and that I was Jewish, male,
right,
an only child, and I actually had a very bad stammer when I was a younger boy, and therefore I was teased quite a lot when I was at school, and that kind of, I felt hurt about that, and I got sort of like kind of familiar with hurt feelings, and I also became interested with the question, why do some boys who, if I'm talking to them one moment, could be very friendly, but in a group they can turn on me and tease me? And so I actually became interested in that kind of shift, and actually my first degree was at LSE. It was on I did a BSc in social psychology. So I was interested in the impact of other people, when you're with other people, how that can affect your behavior.
Group behavior, yeah.
Yeah, and so I got interested in psychology that way. And then when I was doing my PhD, I did a PhD on the subject of self-disclosure. I got interested, a lot of that self-disclosure overlapped with counseling and psychotherapy, and I got interested in it that way, and decided that I'd like to help people. Became a nightline helper, where you would man the phones for students in distress. Became a Samaritan, and around about the same time I started off my counsellor training. And so when I got to 25, or 24 rather, I trained as a counsellor in a 1-year full-time diploma course in diploma in counselling in higher education settings,
right,
at Aston University. And because I had a PhD at that point, and I was in the right place at the right time, I kind of got appointed to the staff. So I'd just done a year's training, and then I was appointed to the staff. And I think what that taught me, and that's been a theme throughout my life, is that I like the variety of academia. I like the variety of practice, and later I like the variety of writing. But I didn't want to commit myself to any one. I'd never been a full-time practitioner,
Right.
And one could say I was never a full-time academic, but certainly becoming academic, because you're training, you have to do practice as well as the academic part. So that has always been a feature of my career, which is, I started off my career in 1975, and God knows how many years later we are. You know,
don't worry, don't worry, you're still young.
Yeah, well, you know, young is defined as you know, 5 years younger than somebody 5 years older than me.
That's right. It makes, as long as it makes you feel good, who cares?
Yeah, it's true.
So, I mean, it's quite interesting, actually, history, because most practitioners, especially working in the psychological field in mental health, have come across some form of way this subject, whether it's their personal experiences, whether it's, you know, in professional experiences. In some ways, they've been intrigued in following this subject, in following this career pathway. And with you, in your case, you was intrigued by these behavioral differences or behavioral attitudes. How can somebody as a single person act in a different way than when he belongs or feels he belongs to a tribe, to a group, to social life as such, or to, you know,
Yeah.
it's often associated, and that's when we go into generally into this world as well, into this society. We have this some form of, and you're an expert in these things, the bystander effect, for instance. People like to belong to somewhere. They don't like to come out of their general behavior, attitudes, or the expectations which are there in this behavior, because they feel ashamed, or they maybe don't want to be the odd one out. They don't want to be judged, or they don't want to be ostracized as well. There could be a lot of fears involved, a lot of stigma involved. Have you actually, in general, I mean, you've touched upon that you haven't actually, you did do your training and you did work with the clients as well as such in one-to-one sessions, but have you actually just followed this pathway in behavioral science, in behavioral research as such? Did you follow that besides your academic pathway? Why this was the reason? Why these boys or this boy was acting in a different way?
Well, I mean, I think that was a stimulus,
Right.
And I think that I kind of you know, I mean, that's, you know, it's interesting, you know, when you get to reflect on your background, and, you know, certain events stand out, and, you know, I mean, I can't say that was the reason, but, you know, it certainly stands out for me. But I think the theme was, you know, do I want to make money? Do I want to help people? Do I want to be in a trade? Do I want to be in a profession? And so I think those were the themes when I was sort of making some occupational choices.
Right.
Certainly, because, as I said, you know, you're not going to get anywhere with Russian, French, and Latin A levels in languages if you can't speak the things. So I had to make some. I did start briefly doing an A level in economics,
right?
But I just didn't understand it. You know, I mean, I just did not understand it, and you know, I didn't like it. You know, I didn't. I think, you know, what I have learned is that if if something doesn't resonate with you,
yeah,
unless there's a good reason to do it, then don't do it, you know. And so I just felt that, trite as it may sound, being of service and being of use to people was something that that appealed to me, as it does thousands of other people. I've just done it in my own particular way.
And you've done it very successfully. I mean, look at you. You have put out over 200 books, which is quite impressive as such. And the reason why I was asking about, especially behavioral therapy or general and group behavior as such, was because if I look at your books itself, they're very much behavioral orientated. I mean, you are leading CBT therapist as such, and you have followed the pathway of Albert Ellis, who brought out the rational emotive cognitive behavioral therapy. It would be lovely if you could explain that to our audience, if they may not necessarily know about that. But the reason why I was asking is a lot of your books, such as single session therapy, which you actually brought out as well, then steps to positive living, you have being your own CBT therapist. It's all about very much behavior orientated. So it must have somehow stick in your mind as such, from, even though it was a stimulus from this boy acting in a different way than belonging to the group.
I don't think that's the pathway. I think when I started to train as a counsellor, the course I went on was heavily client-centered therapy. The label person-centered therapy had not been invented at that point, so it's client-centered therapy, which is quite
new. That's right.
Yeah, and so one of the things that I discovered through learning this client-centered therapy was that although I resonated with some of the theory, I didn't resonate with the practice. And I think that I think that kind of therapy is different from a lot of other professions in a way, because I think it really does matter what your relationship is with the therapy that you practice. And so I couldn't really relate to it as a practitioner.
Right.
And also, although it didn't occur to me at that point, I didn't really relate to it as ideas that might influence my life. So I think I was in a period where, like all courses, you not only study the main one that you're getting trained in, you have to kind of study other things. And I remember watching the famous Gloria films, which is, three developers of psychotherapies working with one woman called Gloria. That was the name that they gave her. I didn't resonate with Gestalt therapy with Fritz Perls. Right. And I did resonate more with the therapy of Albert Ellis, which at that time was called rational emotive therapy. Now, as I say, it does matter what you kind of what resonates with you, and that's why when people kind of say many years later, look, I'm a psychodynamic therapist, but I have to learn CBT. I don't really want to, but I have to learn it, And so I think that's awfully difficult for people, because I think while there's no compelling evidence that any one particular approach is any more effective than any other approach, taken as a whole, I mean, there are particular conditions where some approaches are more effective than others. But I think that what does matter is, I think one of the markers of an effective therapist is that you kind of do practice what you preach. You're not sort of putting on you're not being incongruent by kind of by practicing one thing, but not really believing it. And so I discovered at the time that I couldn't really get on with client-centered therapy. Now, I'm not saying that, therefore client-centered therapy is no bloody good. Or, of course I'm not. All I'm saying is I couldn't resonate with it. And I could with the theory and practice more of Albert Ellis. And I like the idea because it kind of connected with some events in my youth, which
right.
So one of the ideas that I really kind of connected with is this old idea from Epictetus that people are disturbed not by things but by their views of things. It's
right.
the idea that what really matters in lots of areas in human endeavor is the attitude you take to what I call the adversities of life. And so one of the things that I did before I even knew about counseling psychology or anything like that is that I actually learned to overcome my anxiety about my stammer because I was able to draw upon some information that I kind of found out about, and that really showed that the best way of doing that is by changing your attitude. And so I did actually do that spontaneously. So I think there was a kind of close resonance between the way I went about things, the ideas that I tended to see, tended to hold, and rationally motive therapy. And my friend and colleague, Dr. Walter Matweychuk, has wrote a chapter in a book I just edited, and he talks about REBT as a philosophy of living. Now, I'm not suggesting that, I think there are certain ideas, core ideas that are really, for an REBT therapist, if you don't believe these ideas, then, you're not going to do well in teaching other people these ideas. Because it's a bit strange if you don't believe them yourself, you don't live them yourself, you're trying to kind of teach them to other people. And I think that kind of congruence between how you live your life and how you work with clients, if you don't have that, I can't really see how, long term you're going to be really that effective as a therapist. But it was fortuitous really that I kind of got interested in REBT, found out some other people who were interested in it back in the late 1970s. We invited a few people over from the States. They had some training. Then I went to America, and again, the rest is history.
I mean, it is quite interesting to see that this REBT is action-orientated approach, which focuses on changing, making actually sense of emotions and how it executes to the behavior. I mean, it's quite interesting to see, and you're right, you said it rightfully. If you have an approach, if you have a practice as such, which you don't really believe in, you will not be able to execute that properly to your clients, to your students, in which way, form you're ever doing. You need to believe in something in order to, practice it with your full heart, with your full emotions as such. But
yes, but also with a skeptical mind, because I'm not saying that you have to mindlessly. I mean, I don't mindlessly accept everything that Albert Ellis said. One of the things, I mean, he wouldn't want that. One of the things that he kind of advocated is that think for yourself. So there's a number of areas which I've modified REBT and changed things around, and I kind of have some disagreements, and I think that's healthy. But I think that so if you go into it, it's interesting that a little known biography of Ellis came out in 1988. It was called Albert Ellis, Passionate Skeptic. And I think that's a great way of describing me. I'm passionate about what I do, but I'm also kind of skeptical about things as well. you know, I try not to kind of get too drawn into you know, to the what I call the wonderfulizing, you know.
But that is a very healthy way of thinking. Otherwise, you know, you wouldn't pick up on any kind of mistake, because even Albert Ellis, you know, as wonderful he is, but we're still human beings. He's a human being, so there might be difficulties or errors as such which you want to pick up on, or which you may not believe in such full extent.
That's
and
right.
which is why you have published all these books, because you didn't agree with certain approaches, and you found other ways, or you found other solutions, and then you brought them forward. But what would actually interest me, and I think that would interest the audience as well, because the CBT in general, or even REBT, the audience might not have the understanding itself. You know, it's a behavioral approach therapy as such, to change the action, to change the behavior. But how did you tackle your stammer as such, your difficulty?
Well, I think it's, well, let me just kind of comment on what you've just said. I think that REBT is really about you know, recognizing that at the core of people's emotional disturbances is certain attitudes, but the best way to change attitudes is by acting in ways that are consistent with them going forward. And so that's where but it's not kind of a disembodied behavior. It's very much linked to the attitude that you're trying to acquire. So, for example, for me, when I was in my teens, I used to, as I say, had a bad stammer, and also I was kind of anxious about speaking in case I stammered. And so what I would do would be to try and avoid speaking whenever possible. And because I had certain words, certain letters that I would stammer more over, like a D, a B, sometimes a P, I would sort of, which was interesting because my name at that point was David Tenbin. See, I'm stammering over that, which was a bit of an interesting, because it starts with the 2 Ds followed by a vowel. Now, people say, why are you changing it into Dryden? Which I did actually. I said, well, because Dryden's easier to say. The R softens the D. Yeah. I'm not going to stammer over Dryden. So what I used to do is I used to say my name was Avid Enbin, but it starts with a D, and people would think, what the hell is he talking about? So actually, I got more attention doing it that way than I would have done stammering. So I actually kind of, you know, went to speech therapists, learned techniques which were, you know, I mean, okay, but didn't really kind of help me. And so I heard Michael Bentine, who was an old comedian, on the radio, and he said, because he had a stammer, and he said that what helped him was to develop the attitude that if I stammer too bad. And so I thought, well, that's a very good idea. So let's see if I can put that to practice. So I realized, not in any formal way, that if I was going to really believe that, I needed to act in ways that reinforce that new attitude. I needed to stop avoiding, you know, these ridiculous things. My name is David Enbin, but it starts with a D. And so I resolved to do that, and initially it stammered more because I was avoiding less. But the more I practiced the idea that, you know, stammering, it was unfortunate but not terrible, which later I found out was a core idea of REBT, you know, and I was doing something in my own life that very much later on was kind of resonated with the theory of REBT. Another thing I did was I was scared of Alsatian dogs because I was attacked and bitten by a dog, and again I used to be fearful and then avoid it. And then I remember, you know, thinking as again a young teenager, and I was thinking, no, wait a minute, there must be a better way to going about these things than avoiding these bloody dogs. So I decided that I was going to approach them even though I was afraid. And so rather than cross the road to avoid them, I would cross the road to meet them. And so I did that, put that into practice. And after a while, realized that I wasn't afraid of Alsatian dogs anymore. And so that was more behavioral than cognitive, but I think it showed me, both of these things showed me that, you know, there's only going to be a limit to what you're going to achieve sitting in a client's chair. You know, it's, you know, you can learn what to do as a client, but I think that in order to implement that, you've got to take responsibility yourself.
Yeah.
And that's kind of what I did. And so I'm no way am I fearful of Alsatian dogs. I can, you know, happily speak to you for an hour or so without feeling remotely anxious. And the idea that I could have done that when I was a young teenager would have been, you know, I said, yeah, sure, no way.
Yeah.
And so, you know, I think I have really helped myself by utilizing what are in effect, you know, core ideas of REBT. And so there was a book that your audience might be interested in. It's called Embodied Theories. Yeah. It's edited by a guy called Ernesto Spinelli, who's a leading existential therapist, who you might want to get on your program, as a matter of fact, if you can persuade him. And Sue Marshall. And the embodied theory was they invited a number of people, leading British therapists, to address the theme, you know, to what extent do you practice in your own life what you preach, in a way, to clients? And so I, you know, was very happy to accept that invitation to write that chapter. And it's an interesting book because I think I and somebody else came out the most consistent in terms of the way we apply these things in our life, to the way we use it, you know, with our clients. And so I would say that kind of, look, I'm not, it'd be strange if I'm going to stand here saying, you know, therapy is insignificant. Therapy, you know, certainly for the conditions I'm talking about, there's a limit to what you can do in the consulting room, unless you're bringing in you know, an Alsatian dog. That might have been interesting, but I think the idea is that you know, it's I often say to people, you know, if you go to therapy 1 hour a week, that's 1 hour out of 168. What are you going to do the rest of the time? You know? Are you going to go back to old habits, or are you going to practice some of this stuff? You know? But the choice is yours.
So may I understand? I mean, there's a form of exposure therapy, which is, you know, a therapy which is similar to what you're explaining as such, to being exposed to your fears, to being exposed to something you're feeling uncomfortable with. But it's a very action-orientated therapy, so it wouldn't be happening in a room. It would be happening with the client outside somewhere.
Oh, that's right. That's right. I mean, I think if, you know, if you kind of segue into my latest interest, single session therapy, one of the approaches to single session therapy is called one session treatment of simple phobias for both children and adolescents. And what that is an intensive 3-hour session where people are willingly exposed to their, when I say willingly, you know, they'll probably object at the time, but they agree, they give it informed consent that they're going to go into this.
Right.
And therefore you're doing it, and apparently, you know, you can actually achieve a hell of a lot in a very intensive massed practice of exposure and, you know, certain cognitive restructuring that goes along with that. And so what I did wasn't like that. I didn't go out for a whole day looking for, you know, for Alsatian dogs, but I did it fairly routinely.
Right.
You know, I didn't have to, you know, it's something which
I think the consistency is very important as well. Just to have one exposure, although you know, the therapy you're mentioning about with the 3 hours intense session may help, but on long term, repeatedly exposure over time, consistent
I think,
exposure is important.
Exactly. And, you know, particularly recognizing that there's always going to be a part of you which is going to say to you, no, wait a minute, danger, forget about it. But you see, one of the things that I think about human beings is that we can acknowledge we have that part, and that we can choose to go along with it or not to go along with it, to go the other path, the more difficult path, you know, because if we didn't have that, I think it would be kind of difficult to conceive of anything called psychotherapy.
That's right. It's a
we would
fight
already be
flight.
going, we're already, you know, always going along the fight and flight, you know, routine. Whereas if you stay and really face what you feel, or face what you don't want to face, and you kind of are armed with I say good attitudes and good ways of actually kind of responding to the situation. You're not there naked. No. But I think that is useful. So if I can, just for the purposes of your audience, just to say that, you know, I see rationally motive behavior therapy it is a form of cognitive behavior therapy, but it's based on the idea that when people face adversities, they disturb themselves by holding a set of rigid and extreme attitudes to those adversities. And the major goal of the REBT therapist is to encourage them to adopt and then take forward, and to consistently and repetitively practice through behavior and attitude a set of flexible and non-extreme attitudes.
That's right. That's right.
So that they, you know, I mean, for a while, it's interesting because I think if you know, I mean, I wouldn't say that. I mean, I don't like dogs anyway as pets. I think that I go along with Jack London's book, A Call from the Wild. You know, dogs are basically wolves. You know, and but so I wouldn't say that I like dogs, but I certainly don't have an aversion. I'm sort of kind of indifferent to dogs, even to Alsatian. Oh, I still might get a twinge if I saw an Alsatian, but public speaking, what I did find was that I went from fearing public speaking to disliking public speaking because I still didn't like the idea of stammering, to actually enjoying public speaking. And that is something that I didn't expect to happen.
Right.
And so, you know, I quote this, and say, well, look, you don't know now, you know, at the moment, what I'm going to help you to do is to take the disturbance out of this, not the fact that this is an unpleasant experience for you, but you might find later that what you find to be an unpleasant experience might be pleasant if you have an open mind about it.
That's right.
And
that's
so,
right.
you know, I mean, you know, believe me, if I found public speaking unpleasant, I would not be speaking to you here.
I mean, in general, it's quite interesting, actually, because all what you're describing is also about reprogramming your mind, reconditioning your mind, you know.
I don't like that language, you know. I think reconditions are for engines, you know. Reprogramming is for computers. I don't like that language. I've never liked that language. I kind of like the idea of, you know, developing healthy attitudes.
Yeah.
You know, that's what I'm trying to do for myself. And, you know, if it makes sense for my clients, to help them to develop a set of healthy attitudes that they can, you know, deal with adversity, because, you know, you are going to face some kind of adversity.
That's right. And it's all about, you know, it's all about managing as well, these things. That's what you're trying to implement, rather than running away.
Not just managing, but to deal with it constructively.
Yeah.
Yeah.
I mean, in
So,
the term of the dog itself, I can actually resonate to that, but that has historical background reasons for me. Because when I was little, I was actually cuddling a dog outside, and I think I must have only been 6, 7, 8 years of age. And I came home, and in my household, it's similar to Jewish household. It's quite clean. You have to adhere to certain rules as such. And my mum said she always used to say, or I've grown up like this, that dogs are not clean animals as such, you know, because they're not like cats who lick their fur as such and clean themselves. So you must not touch them. So as soon I came home and I told my mum, oh, there was such a lovely dog, and my friend told me, oh, it's such a lovely dog, come on, we cuddled the dog, and I cuddled the dog. So my mum was quite rigid with that, and she said to me, go to the bathroom and wash your hands 7 times. And that must have created some form of phobia or fear inside me, that I thought, oh my gosh. And since then, I was actually not just reluctant. I mean, I don't hate dogs as such. I don't hate any animals, but I developed a sort of fear and dislike towards dogs for these kind of reasons, most probably. And I could not actually just pass this fear. Every time I would see a dog in front of me, I would kind of use a different pathway or just walk around it, so I wouldn't be close to a dog. But what has actually changed, and that was very unintentionally as well, by chance, I went to someone who had a Pomeranian, very sweet. It's a different form of, I think, cross race of a wolf and a dog, and it stays small. It stays very small, and it looks like a teddy bear, like the one in the background on the chair.
that's my original teddy bear.
Well, that's lovely. Is it one of the Steiff ones, I'm guessing? So the dog just looked like a little teddy bear, and he wasn't even acting like a dog. I mean, yes, he barked, but he wasn't acting or looking like a dog as such, and he was just sweet. And he was the first one where suddenly I thought, that's a sweet one. And I don't know what came in my mind, and I suddenly started cuddling him. And since then, every time I've seen that dog, he remembers the way how I cuddled him and I stroked his fur, and he comes to me, walks around me and barks, and lovingly as such, wants to be loved again. But since then, I've noticed every time now I've been exposed to another dog, even big dogs, I don't necessarily love them or like them as such, but this fear has somehow gone. So if the dog is driving me on the pathway, for instance, on my leg, and before that, I used to just jump up and walk to the side, which I don't do normally. So it must have had some form of effect, Yeah. And in this way, repetitive behavior, which I have done then unintentionally, going to that dog, cuddling that dog, driving his fur, must have done some differences. And that's why I can resonate to what you're explaining just now.
Is your mother still alive?
Yes.
Don't tell her.
I don't think she knows.
She does now.
She most probably does now. That's right. I mean, my son is, for some reason, he loves dogs. I haven't brought him up with a dog, but for some reason, he's always asking me for a dog. And since I've been exposed to this little dog, I offered him, I said, I will get you a Pomeranian. That's the only dog which is coming into the house. You can cuddle him. You can take him anywhere you want. We can wash him every day so he stays clean. But yes, that's the ways in just working around your attitudes, changing your attitudes, changing your behavior, and going into a healthy kind of state as such. And it's interesting to see. I mean, do you have any kind of examples of something which maybe resonates to you from a client perspective, which you worked with, which you can actually vividly remember what has changed in their behavior using this form of therapy approach?
In their behavior?
Yeah.
Oh, yeah. I mean, quite a bit. I mean, people.
Something which is quite, which has actually stayed in your memories as such? I'm sure you worked with lots of clients, but something which was very different.
You mean something that a client did that was sort of memorable?
Yeah.
Well, yeah, I mean, several things. I mean, sort of, I think mainly the one situation that kind of stays in my mind is of a person who was very, very sort of phobic of any kind of rejection. And then, because my take on rejection is that quite often, you know, the most important thing is not being rejected by another person, but you rejecting yourself as a result. So as a result of really helping her to build up what I call being able to accept herself in the face of rejection from others, she was able to assert herself and recognize that, which often happens, that when you do that, you recognize that you overestimate the extent to which you're going to be rejected. But this is the bit that she actually was rejected. And so previously she would have kind of crumbled and crashed, but you know, she didn't like it, but she kind of saw it as, and I remember her coming back and says, look, you know, actually it's not that bad, is it, to be rejected? And that's always sort of, you know, stuck in my mind. Yeah, it's not that bad.
That's right. It's another form of exposure again. Absolutely. Yeah. To experience these things actually consciously.
Well, the thing is with exposure, you see, quite often it's difficult to actually, in the same way as afterwards I ran out of dogs, you know, actually, if you really do, you know, go up to people, they will reject you far less than you think they will. Yeah. But what leads you to overestimate is your attitude about the rejection. If you kind of think that rejection is horrible, you're more likely to see rejection than if it was, you know, if you saw it as unpleasant but not horrible. And so, you know, I mean, there are other vivid things that stand at my mind that I don't feel comfortable because the person might see this and recognize herself. But that kind of, that's a common one that kind of sticks in my mind.
Was that the reason why you brought out then the book of assertive behavior as such, which you've done a number of years ago?
No, I wanted to have a self-help book on each of the 8 different emotions that people come to therapy for, and then moved on to a book on assertiveness with my person I wrote it with, Daniel Constantino. We wrote it together, and the idea is that I think that for some people, not everybody, they can take a book, look at it, glean what they need from it, put it into practice, and they may need to not need to consult a therapist. And so I enjoyed writing self-help books because I think it's another way of educating people. My interest in single session therapy is because I think that a lot can be achieved in a single session if the conditions are right, and that we can offer help at the point of need rather than at the point of appointment availability, which may not be for for a long while. I think that we can actually, you know, do a lot to help people. And the modal number, which is the most frequent number of sessions people have across the world in all kinds of agencies, is 1, followed by 2, followed by 3. And I don't think that we like, for example, I'm reading a book. It's actually quite a good book. It's on the working alliance skills that you need to develop. There's nowhere in that book that points to the fact that a lot of the time people are only going to come once. It's predicated, the whole book is predicated on the idea that, you know, there's a beginning and there's a middle and there's an end, and that happens. I'm not arguing it doesn't happen, but a whole host of you know, quite frequent information is just locked off. And it's
Right.
not just in that book, but in a lot of books, you know,
Yeah.
some of my books in the past, you know, I didn't know about single session therapy when I was writing a lot of my books. I do now. And therefore, you know, I'm sort of, when I come to write a book, and it's not about single session therapy, it's about something else, I certainly would be mindful about that. So
and what is,
go ahead,
yeah,
go ahead.
carry on. That's
No, go
fine.
ahead.
You continue.
So I think what I got interested in is how to help people help themselves quickly. That's what I'm interested in.
So is that the essence why you brought out the single session therapy as such?
Well, I didn't bring it out. I mean, I probably at the moment the person in Britain who's most responsible for kind of, you know, spreading the word about it. But I came to it really in 2014, and you know, it's been going on since. Well, the modern developments started in 1990. So I mean, you know, there's been a whole host of people before me, but I think that nobody in Britain really was really kind of banging the single session drum as I do now. And so
I mean, do you want to explain what that actually means, what this model actually contains as such?
Well,
what it exactly differentiates from others?
Yeah, well, first of all, it's not a model. It's a combination of a way of thinking about delivering services and the practical implications that flow from that mindset, and a way of delivering that within an agency or within your private practice. What it stems from, the idea is that let's see if we can help you with, you know, and you've got to be completely knowledgeable about this. We're not going to spring it on you, but let's see if we can, you and I, join together to help you to take away from the session what you hope to get from the session.
Right.
If you can't, more help is available. And so it's that, on the one hand, let's see if we can help you today. And if it is, that may be all you need. If not, further help is available. Let's bring those two ideas together. And the important thing is that we see you quickly rather than you have to wait a long time. And we help you to mobilize your own resources as much as we can as well. And so
it's giving the option of imminent help, but at the same time having the option for a longer therapy approach as well if needed.
If you need it. Like, so for example, I was on a webinar today, I introduced these ideas into a CAMS up in Nottingham, and their data shows that they're now offering all their young people from, I think, 11 upwards, or 13 upwards anyway, this opportunity, and 68% of the people who they give a single session don't require any further help. Now, previously, this 68% wouldn't have got that help quickly. They may have deteriorated to some degree. Right. Now, we're not saying everybody should get a single session. That would be completely silly. But let's not withhold quick help for those who need it. And bearing in mind that we don't know who's going to benefit from it and who don't. We can't tell in advance who's going to benefit from this. So people say, what conditions? No, that's not the right. No. Give everybody a single session, then you'll find out who's going to benefit from it. And you may be surprised.
And that's the good thing about accessibility. I think what most people are frustrated about, and which you're pointing out, that it's accessible, it's imminent help, rather than for somebody who has to wait maybe in a long queue. Unless
you choose to wait.
That's right.
if you kind of, you know, somebody comes along and said, look, you know, we can see you right now and see if we can help you, you know, as much as we can, or maybe, you know, you're complete in terms of what you want to do, or you can wait to access this program, which will start 10 weeks. Choose.
Yeah. And that's the good thing about that. If you're giving the option to people having imminent help or choosing a long-term therapy.
Now, actually, what some people do is they say, well, look, okay, I'd rather have that 10-week help, but look, okay, I'm willing to give it a go, you know. And when they are, and just to say, because I have to go in a minute, the biggest obstacle to the development of single session therapy are therapists.
Yeah, that's right.
Because it kind of challenges a lot of what they cherish about the development of a therapeutic relationship. You know, it takes time, and we go for relational depth, and we really and I'm not knocking those ideas. For those some people, those are fine, but not for everybody. Not everybody needs a deep relationship with their counselor.
That's right. Absolutely. And often people just come, just quickly, you only got 3 minutes of your time left. Often people come with, or they just suffer with maybe fear as such. It doesn't even have to be a developed mental health condition or depression as such. It could be just anxiety. Or
you may have a mental health condition, but you may want help about something else.
That's right.
You see, often people say, what about borderline personalities? Well, I say, well, borderline personalities have got, you know, problems of like, you know, everybody else. They're not going to listen. I'm not going to cure borderline personality disorder in one session, for God's sake. You know, that would be nice. But I think if you're open and to say people what you can do, what you can't do, you're transparent.
That's right. And it can sometimes open up barriers as well, where somebody wouldn't be engaging at all if somebody was given the session of, or the option of, this one session. They may just open up to more opportunities, to more availabilities, to more therapy approaches as such, you know.
Well, thank you very much for giving me an opportunity to have a single session with you.
Thank you very much for being my guest.
My pleasure. You take care.
You too. Bye.